There are certain requirements under what's called HIPAA, which I'm sure every person in the medical world knows. And there's also confidentiality issues that arise just as a general amount of practice. If for instance, records were stolen or lost or destroyed, you need to make sure, particularly in this day and age, that you are keeping your records electronically and can back them up. Most of the states now require training in that, and it's part of your ethical duties. You need to alert the patient if for any reason their records have been compromised, and sometimes physicians are reluctant to do that, but the better course of practice is they ultimately are records of the patient and of their treatment, and therefore you should notify the patient of any loss. You should absolutely take proactive steps if it's an employee, a former employee, or if it's a theft or a loss, to notify appropriate law enforcement authorities. Patient records are confidential, serious matters where your patients are entrusting themselves to your care, and you are getting intimate facts about their emotional, physical, and other systems to evaluate them for treatment. So the best course of action is, if there's a compromise, first of all, you have to have an attorney. I would argue that you really need to have a lawyer involved with that, reviewing that, and you need to be advised of the steps along the way to make sure that you minimize the disruption that can be caused by that loss.